Well, I think the main message is that patients are an asset, not a drain on the system, but an asset, and helping them, supporting them to do more to help themselves is something that could really transform health systems. And unfortunately, at the moment, they aren't properly supported to help themselves. What I think needs to be done to improve the situation is to recognise that everybody, all of us, when we're ill, bring things that we can contribute to our own health. So health professionals need to take the time to work out what it is that the patient wants, what their goals are, what their preferences are, and then what kind of support they need to do the best job for looking after their own health. And the good news is that there's good research evidence which shows that that produces better outcomes and indeed lower costs. I think health professionals find this difficult because they're trained to see themselves as the experts. They trained for a long time in medical schools to learn an awful lot about diseases and treatments. What they don't necessarily learn is how to involve patients in the decisions, how to recognise that patients are experts too. They have a different kind of expertise, but they understand about what it's like to experience their illness in their situation. So it's a hard lesson for health professionals to learn, and it needs to start in medical school, I think, and nursing school. They really need to look at training programs and turn them sometimes on their head, recognise that patients are experts as well. And the key task is to understand how to draw out that expertise. I have seen health professionals eyes open when they work directly with patients, and patients themselves give them feedback on how things could be different. And often doctors and nurses think they're doing this already, and it isn't until they have a chance to look at what they're doing and look at how they relate to their patients that they suddenly realise they're not doing it. So it is possible to change, and I've seen many health professionals change their attitude to patients altogether.